As many of you know, the Y is the nation's leading nonprofit, community-based organization dedicated to strengthening youth, adults, families, and communities to be healthy, confident, connected, and secure. Over the past 2 years, the Y and the APA have worked together at the national level to strengthen the ability of both organizations to create and support healthier lives. At the local level, we're encouraging psychologists and Ys to collaborate on programs and workshops to address issues such as creating healthier environments to decrease childhood obesity, increase childhood resilience, and to reduce stress. Making decisions to lead healthier lives is about making simple changes to everyday routine, but it requires building supportive relationships and providing environments rich with healthy choices. And it will take all of us working together to move forward, one community at a time. I was struck, as I'm sure many of you were, between the gap between knowing what we should do and doing what we know we should do. And one of the ways that the Y, which is community-based, tries to help with that is to create relationships between the people we attempt to serve and support groups, so that it's not just you and your willpower alone, but it's other people who have similar problems that you do that are trying to solve them together. And we bring that force of community and relationships together here. There was a day that the YMCA would say, we know what's best for you. We have all the facilities and world-class personal trainers and the best pools ever. Come on in and we'll show you what we have, and you're now going to be healthy for the rest of your life. Has anybody ever tried that before? And we have a term for the people in the Y who genuinely want to do that, try to do it, and don't quite succeed. And they're called health seekers. And what we found in our on-the-ground work, and we love working with you in the APA to learn much more about what the data really says. But what we find is that people are not going to make it on their own, that they need the support of the whole community. So instead of saying, come and watch our pools and meet all the things that we have for you, we say, well, before we go, tell me about what your goals are, would you please? What brought you in today? What are you looking for? Often it is health. And we'll say, well, is this a new goal or is it a goal that you've had in the past? Well, often it's a goal I've had in the past. And what's happened? And we really try to understand the dynamics of that individual and then bring all the community, all the different agencies, all the different relationships that we're in part of to that person and bring that person to the relationships. Today, the holistic view of health is particularly important because of the studies showing the interconnection between mind and body. It's not enough just to work on one and ignore the other. I have to click my thing better here. Oh, here we go. I want to talk with you about one approach that we feel is going to be quite helpful. It's a modification of what we've done in the past. It's called Healthy Family Home. In fact, right now we're unveiling the updated Healthy Family resources in just a few days, in a few weeks. So today you're getting a preview of some of that new content. Healthy Family Home gives parents and families helpful information, tips, and support for their efforts to practice the art and science of healthy living. It's based on 5 pillars that support a healthy family home. Eat healthy, play every day. Now, has everybody here got their quota of play in yet? Adults need play as well as children. 3, get together. 4, go outside. And 5, sleep well. We suggest families use these categories to create their own goals and their own healthy habits. Not just that we can tell you what to do. We know a lot of people know that. But using these categories, how can we generate families creating their own strategies, goals, and objectives? We'll look at first, eat healthy. Cutting out drinks with added sugar adding more water and 100% fruit juice and low-fat milk to your family's beverages choices can create a big difference. Generally, it's not too hard to do that. Aiming for it to eat at least 5 fruits and vegetables a day can be very helpful to everybody's health. And these will be available to you later. I'm not going to go to each point. The second, play every day. Adults as well as children need activity on a daily basis to help manage stress and reduce frustration. We've all been in stressful meetings when somebody, God, thank you, made a joke and everything, all the stress will just go away. And that's the benefit. One of the benefits of the play is laughing at your own self, laughing at your friends. Play is a child's work. Nature created a child to explore, to ask questions, to laugh, to experiment, to try new things, to copy each other. All that play is how they learn. And they learn very, very, very well through that modality. A third pillar is get together. Have family time. Put it in your schedule. And there's a little piece of getting together that I'd like to share. It's not just getting together as your one family unit. Let's say it's 4 people, where each person has a role. And they can modify their role a little bit, but they have a role and it's predictable. Get together not just in that unit, but in dyads and 2s and 3s, and do a special thing with your son, or go someplace in the afternoon with your daughter, and make sure that the mom and the parents have some time together. And what happens when you do that sort of get together, as well as eating together as a unit, is you get to know each other. You get to take time to find out, what do you want to do right now? And you get to be a person, so you're not left with 91% of the children knowing you're stressed and you thinking that you're doing a fine job of letting the kids know you're not. So that's getting together, preparing meals together, playing board games, having meals together. Service projects are fun. There's always work days at our camp that you can bring your whole family to, and you'll have a lot of fun as well as doing good deeds. But there's many, many service projects. And the second to last one is to go outside. Many of us, especially in urban environments like New York, work indoor all day. Then we go to our home at night. It's really important to get fresh air and to see nature, to be part of the creative forces of nature, because we are part of nature. I've been at the New York YMCA camp for 3 years. My first week, I was running through the forest and jogged most mornings. Came out in a road by an athletic field, and I was hoping the kids would be there, and there were. There was about 9 or 10 6-year-olds at a picnic table. And I went over to them, and I was kind of sweating from jogging. And one of the little boys had his eyes wide open from New York City, and he says, "Why are you running?" Well, I said, I love to run here in the forest. It makes me feel good. It's a great way to start the day. And I get good exercise. And he didn't listen to a word. He said, "Is somebody chasing you?" And all the children looked up the road to see who might be chasing me. And I said, "No, nobody's chasing me." And he just couldn't understand what was going on with this unusual guy I was. And he said, "Why are you running in the street?" I said, "Well, nobody's in the street. Don't you know you'll get hit by a car?" And I said, "No, I really won't. There's not too many cars." He said, "What if one comes up behind you?" Well, I said, "I could really hear if a car came up behind me." I said, "No, you can't." I said, "Okay, do me a favor. Let's do something together. Close your eyes for a second, would you?" And I made a little snapping sound behind his head. "Okay, open up. Did you hear a sound?" "Yes, I did." "Where was it?" "Right behind me." "See? You can hear things behind you, and if I heard a car, I'd get off the road." Well, being 6-year-olds, the new topic became what you can sense and understand in the world with your eyes shut. And that moved to the sense of smell, and it turned into a great conversation all about the smells you can find in the world without opening your eyes. But as I left the child, as I was running further down the hill toward my home, it occurred to me that this child had never seen a man running in freedom for the love of running. And that's what the outdoor has for children, is freedom, where you can move your body, where you're not going to get hurt, where you're safe, where you can breathe nature, you can breathe air, and enjoy all that nature has created for us there. The last pillar is sleeping well. We often overlook it as we overschedule our lives, overschedule our children's lives. And there's many things that we can do to make rest a priority. We can decide every night to read a bedtime story to our child and start it earlier, because the child is going to want to have time with you. Agree to turn the TV off 1 hour before bedtime and have time together. Agree that we're going to be in bed at a specific time. The parents and caregivers can determine, I'm going to go to bed at a certain time tonight, and really do that. So sleeping is also very important. Healthy Family Home is just one example of the way Y supports families. We made an intentional effort to support all individuals who struggle to adopt and maintain healthy lifestyles. Healthy Family Home is just one way Y support families in achieving their goals. Thank you for having me. Thank you, Dr. Anderson.